The exhibit hall is coming down around us. We're at ATA and they're about to roll up the carpet. But we've got 2 minutes of questions and answers for you on Health in 2.0. That's Matthew Holt. We're at ATA, the American Telehealth Association annual meeting here in
it's the American Telemedical Association.
Oh, they changed it?
It hasn't become telehealth yet, I don't think.
Oh.
We don't know what it's called.
Either way, ATA, we're here and it's in beautiful New Orleans. We've made it safely back from the French Quarter last night. Some of us safely than others.
Yes,
it's true. So do you have your timer ready, Mr. Holt? We're going to ask you all about ATA.
Steady and go.
All right, Matthew, what did you learn about virtual care here at ATA?
So I learned that the Cleveland Clinic has only ever done, in all its history, 50,000 virtual visits. New York Presbyterian last year did 150,000 virtual visits. Right now, it's a pimple on the rear end of the healthcare system.
Wow.
There is still very low adoption of telehealth visits. It needs to bring much more stuff into the equation to do, to really make a big impact on the chronically ill, but it is growing and there are lots of companies around doing interesting stuff, so it's on the cusp.
Favorite exhibitor that you ran into here?
Oh, definitely. Turn around. Rhinogram.
Woo!
Because we found out that rhinos have a sage bird on top. I have no idea what Rhinogram does otherwise. It's like a texting thing that you can text into a system. But very cool. They have the best thing. But we did have a very interesting conversation with Eagle Health. Because we found out that there was a
convocation of eagles. A group of eagles is called a convocation.
But the best that we found out from the people who run Rhinocare used to be at a company called Jellyfish, that the concept of the number of jellyfish will group together is called a smack of jellyfish.
Okay, but on to more important things. The CMS rules that have changed Medicare Advantage reimbursing telehealth differently. What's the deal?
Roughly 35% of Medicare recipients are Medicare Advantage. They're now going to be able to offer telehealth and their basic benefits, which should be a big boom to it. More and more people going into Medicare Advantage. We'll see what happens with Medicare for All, but that's a good thing that will help telehealth. Medicare is also, in fee-for-service, reimbursing remote monitoring and chronic care management, so helping get us towards where we need to go.
Totally. Big raise this week was Cityblock at $65 million.
Cityblock. This is a fantastic new service, came out of Google. 65 million, I think they're at now a total of 80 million or so. Really interesting, delivering care to the poor for Medicaid. Really interesting model. I wouldn't recommend moving to New York and becoming poor just to take advantage of it though.
Okay, what about Microsoft shutting down the HealthVault? There it goes.
Oh, so sad.
I asked it.
It's over.
Don't even try to stall. Oh, so sad. It's over.
It's over. It's over. Microsoft, I got to watch it. So, I am very upset about this just because the reason there is a Health 2.0 and I'm in this business at all is because Microsoft and Google were both about to launch something when we started Health 2.0, and everyone came to our first conference to find out what they were going to do, and they wouldn't tell them. Neither Microsoft nor Google would tell. But within a year, they'd done Microsoft HealthVault and Google Health. Both of them are dead, pretty much forgotten. Although those companies are doing more stuff, they're going out with us. So it's a sad, it was, obviously before its time, it didn't make sense. The healthcare system did the wrong things. But at some point in the future, people will get access to their own health data and control it on their own. It is going to happen, hopefully in my lifetime.
It's the end of an era. Maybe
this
is Health 3.0 now.
End of the beginning. Don't say that word.
Sorry.
Say that word.
Okay, so the exhibit hall is literally shutting down around us. You can see the lights going off. If you guys have any questions for us about what else happened here at ATA, please feel free to tweet them to us. I am at Jess and Matthew, and he is at Boy. Make sure that you follow along with all of our adventures to all of the different conferences on the healthcare blog. You can subscribe for our e-newsletter, never miss an episode of Health in 2.0, or you can find us on YouTube. Just search Health in 2.0. Matthew?
Bye, Jess. It was fun hanging in New Orleans.
It was very fun hanging in New Orleans. Next time, we're coming from Mardi Gras. Thanks for watching, everybody.